We're getting back to thinking like a herbalist and what can herbal medicines help and how can you use them for yourself or your family or any others that you want to help in terms of dispensing herbs. If we imagine ourselves in a health canoe and we're sitting nicely in the middle, maybe with section A wobbling a bit from side to side, an occasional cold, an occasional little bit of eczema, just to remind us to get back to healthy habits. And we might use the herbs as a tea or a help just to modulate our systems, but we're not in too much trouble. If we go on to B, we're finding that whatever our health Achilles heel is, whatever it is that tells us that our health is poorly, whether it's chronic sinusitis or tendinitis or digestive problems or recurrent infections, whatever that vulnerability that we have with our health is coming a little bit more often, a bit more serious when it does affect us. For example, it's not just a little minor flare-up of eczema, it's becoming quite red and angry and spreading. That's what's represented in slide B. In slide C, we find that we're going further adrift and the eczema is there permanently. We can't get rid of the sinusitis. Our irritable bowel is flaring up so that it's bothering us on a daily basis. We're getting less and less happy with our sleep, maybe more stressed, more anxiety symptoms, sleeping poorly. Everybody has an Achilles heel, and we find that we're in deep waters, barely able to get back to a nice, smiley, healthy position. And we start functioning poorly at this stage. The sinuses is so bad that it's actually meaning that we can't do our work, we can't get organized. And this is where the healthy habits really go adrift, because that requires a certain amount of energy to keep it flowing. This is where things are going from moderate to severe, and we're in deep trouble. Section D is where we've actually fallen out of the canoe. So you can imagine yourself adrift in the water and things are seriously in bother. It's very hard to get back into the canoe. We generally need two people to help us into the canoe unless we're professional level canoeists. So we need a lot of help. We may need medication at this stage, but we're seriously in difficulties with our health. I'm going to leave you to reflect for a minute on when is the best time to see a medical herbalist, when is the best time to use the herbs for over-the-counter self-help, and how can we most effectively use herbal medicines. Okay, that was only 20 seconds to reflect, but it lasts a long time, doesn't it? At slide A, people are unlikely to pay enough attention to really bother using the herbs on a systematic basis. They may have found that certain herbs help to keep them in a nice, smiley, middle-of-the-boat condition, and herbs like that would be things like using chamomile tea on a regular basis, or lime flowers, or mint. And people just find that using gentle herbs like that just keeps everything regular, maybe concentrating on taking extra fibre for their bowels, and that keeps them on that level represented in section A. Section B is where people often resort to the over-the-counter remedies for flare-ups. They go back to their background teas, they make sure that their health is good, but this would be normal to mild health problems. And if people are sensible or if they're knowledgeable, that's when they will pay attention and use the herbs very cleverly, not to go too far adrift. Section C of the slide is when most people look seriously for over-the-counter remedies. Things have gone a little bit too far and they're in enough trouble to get them to focus, to get them to organise the supplies, to go for help for over-the-counter remedies or seek ideas and further knowledge and go out and actually pick what's in their garden, whatever. So this is when the sinusitis has become a regular problem, the eczema is fairly angry and flaring up on a regular basis, and there may be needing to use steroid creams. And this is often where people start looking for the herbs. I would encourage people to start looking at the herbs when they're in a B situation rather than a C situation. A C situation means that you would need to use the herbs on a regular basis for 6 weeks to 3 months generally. And that's because it takes 3 to 6 months to go from slide A to slide C. Usually the body has been under stress for about that length of time. If the body is under stress for 6 months, you want to leave about 4 to 6 weeks for the herbs to be effective. And the herbs need to be taken consistently. If you've fallen into deep waters and you're needing a collaborative approach with medication, or you're just so not able to function on a regular basis that you need intensive, individualized medicinal herbs, well, that's when I would see both your usual medical advisor, but also a medical herbalist, in order to figure out individually as to which symptoms need to be calmed, which background systems need to be supported. So you're really encouraging people to seek help when things are going a little bit more adrift than they like. The adriftness is happening on a more regular basis, but the symptoms aren't serious and intense and severe. And as people gradually get used to using herbal medicines, or as they get experience in using them for themselves, they will instinctively go for interpreting their body. It's a way of interpreting what's happening inside your own body, interpreting it at B as needing support, rather than ignoring the symptoms, carrying on regardless, as in slide C, until you're so sick you're needing medication or prolonged, consistent use of the herbal remedies. All of these, of course, are in conjunction with the three-legged stool that we talked about earlier, the stopping the unhelpful habits, the promoting the helpful habits, and taking the herbs. I like that diagrammatic representation because we don't want to be in a D situation, and that's not the ideal time to go and see a herbalist. Most people come to a herbalist when they're at level C for self-help and for knowing and understanding your own physiology. I would urge you to get used to encouraging yourselves, your families, and any clients you might see to use the herbs when they're in the B boat. So we come on to thinking about stress and insomnia. These are very common reasons for people to reach for the herbal medicine teas and medicines. But I think it needs a little bit of kind of background. If we think of the tension in our neuromuscular system as like an elastic band, if you throw an elastic band on a table, it will be in a nice, relaxed, usually an oval or a round shape. There'll be no tension on it, and it's in a highly relaxed state. Now, if we imagine the tissues as an elastic band, we're rarely in that state of utter relaxation, and in fact, it would not be normal to be so, because we need a certain amount of stress in the neuromuscular system, even to get out of bed in the morning and to be motivated. If you imagine stringing the elastic band between your index fingers on both hands and exerting a little bit of tension, maybe 0.5 centimetre, and that would represent normal, relaxed, plenty of give either way to relax or to tighten up, and not at risk of breaking or snapping, just nicely tight or taut with a degree of tension. When people suffer from stress and insomnia, it's like stretching that an extra centimetre. And this is a small elastic band, so that makes it pretty tight. And you're thinking, gosh, that's just a little bit too tight for comfort. Not about to snap, that would be very severe stress, but just uncomfortable enough you can feel the strain against your fingers. That's the state of the tissues reflecting the biochemistry and metabolism of people who suffer from stress and insomnia. There's no one herb that will relax that. There is no magic herb. Wouldn't it be lovely if there was? So you're still imagining that elastic band, and you're looking for a range of actions that would relax that nicely with few side effects and a consistent effect, which would have the result of helping people to feel more relaxed during their day and help them to sleep better at night. So we're thinking of nervines. I particularly like to use bitter nervines because they relax the vagus nerve. Remember the brain chemistry? Digestive herbs, because digestion is the calling cry of all herbalists. The digestive tract is so extensive, it has such a huge surface area, and it has such an integrated biology with the brain. I'd like herbs that are nourishing, both generally nourishing and specifically nourishing for the nervous system, and will help the assimilation of all the nutrients that we need for good nervous system functioning. I'd like an anti-inflammatory herb, because the more stressed we are, the more we are prone to injuries, the more we're aware of our injuries and any source of pain that we have. A muscle relaxant, because I don't know anybody who isn't stressed, who doesn't have tense muscles, particularly around the chest and the throat and the neck. In fact, I had one patient who, after her first prescription, came back 4 weeks later and said she felt like she was no longer wearing her shoulders as earrings. So if you imagine any of the people in your life who are stressed, or how you feel yourself when you're stressed, it's like your chest is locked down, your shoulders are tight, and your neck is just that little bit tense and rigid. So you'd like a nice muscle relaxant. Antispasmodic, I know that if I get very tense before an interview or something stressful, I can get a little flicker in my cheek. People would often develop little tics in their muscles, and that represents spasmodic action. Diaphoretic, we tend to get sweaty under our armpits, and where there's a concentration of sweat glands when we get nervous and stressed. A diaphoretic action is, it generalizes that over the whole body area, so that we don't get this uncomfortable perspiring effect, which is so typical of anxiety. Heart tonic, very common for people to get palpitations, particularly women around the time of the menopause. Something that includes a stamina action and an antispasmodic action for the heart would be very nice. And we've talked again about the effect of bitters on the bile and increasing the bile and stimulating the vagus nerve. And again, this is a generally anti-physiology of stress effect. If you come back to your elastic band, if you support your general metabolism with all of these actions, can you imagine that the elastic band will go towards reducing that 1 centimetre of extra stress and going back to a more comfortable level of tension? So that's what we're looking for with herbal medicines to treat stress and insomnia. I thought it might be useful to include a way of finding a well-qualified medical herbalist. If somebody has a degree in herbal medicine, you are assured of a certain standard. And if it is in clinical herbal medicine, you know that they have completed all of the necessary training to clinically examine and diagnose patients' problems. Things are difficult because accredited courses are hard to come by. And there are some excellent herbalists who aren't necessarily recognisable by an academic qualification. And undoubtedly, academic qualifications have their limitations in terms of understanding traditional and energetic practices. A good herbalist will have an eclectic mix of academic qualifications and also an apprenticeship, which can be self-directed and is in touch with the energetics and traditions and indeed spirituality of herbal medicines. So there's no perfect system. If you are considering a medical herbalist, always look for a good recommendation. Always make sure that you understand what training they have and what is their scope of practice. Also, make sure that they have professional indemnity, insurance, and that's really the best that we can achieve at this time. What can I say about Valerian Relax Blend? At a time in this part of the world when it seems like we have so much and yet so little, in which our lives are very full of choices, but yet we don't seem to be thriving, or many of us don't seem to be thriving. As we overthink, overanalyze, lose an hour and a half of sleep every night in the winter and 1 hour every night in the summer since the invention of electric light. We seem to be running on treadmills inside our own minds and physically in the real world, with travel going faster and faster. And it seems that raising children gets more and more complicated. Caring for the elderly is fraught with stresses. There is never, it seems, a time when we need anxiety herbs more than at the present time. However, the reality is that we have always lived in stressed times. It seems to be a function of the human condition. And the majority of this blend is based on a formula used by Duncan Napier, a Scottish herbalist in the 1860s. He also included St. John's wort, which we can no longer put in over-the-counter herbs in Ireland due to regulations, but it would certainly earn its keep. There are a lot of herbs in this blend, and they all seem to help each other to have an overall very effective calming for mild and often moderate stress. It's my experience that if stress and anxiety is very severe, that this herbal blend just doesn't quite get over that threshold of very severe unless you use very high doses, and that would be under the care of a medical herbalist. So very severe stress is certainly an indication for seeing a medical herbalist, in particularly because anxiolytic medication is so highly addictive. And herbs can also be used with the other medicines that are prescribed for severe anxiety and indeed depression, which would be antidepressants. This is a blend which can be used for short-term stress, such as an upcoming interview. A common time to use it is when you have a pattern of migraine that after intense activity or intense stressful build-up, the first day you relax, like the first day on holiday, is when you get a migraine headache. And a person in this situation should use the valerian blend for 10 days, 14 days, building up to the end of the stress so that the body can better cope with the sudden reduction in stress levels. But really, this blend is designed for all of us who feel like we are living in a field with a bull. We are using the adrenal gland to constantly manage what it perceives as acute stresses as the bull moves and we move, and we're constantly looking in the direction of where the bull is. Even though it's a very big field, we feel constantly tight and tense and alert. For many people, they get exhausted and they suffer from fatigue because they actually run out of adrenal function to cope with this stress. It's not a collapse in a medical sense, but it's an exhaustion or depleted state. So the Valerian Relax blend of herbs are very good for supporting us in managing that chronic stress. But as we've said before, without changing our lifestyle, without making modifications, the herbs will just support poor function or weakened function. Without changing the lifestyle, we will not get ahead of the problem. We'll help manage the problem, but we won't get ahead of the problem. When we're stressed, we have all kinds of physiological symptoms. We get palpitations, we get a headache, like a tight vice around the head. Often people get a feeling of sore throat, is a common symptom of ongoing stress. We get tense around the shoulders, we sigh, often uncontrollably, sometimes we yawn uncontrollably, we can't sleep, which then is a further driver for the poor function, or we have disturbed sleep or restless sleep, difficulty getting off to sleep. All of those will make the situation worse. So there are lots of physical symptoms to register chronic anxiety, fatigue being a main one. In these circumstances, it's important to have thyroid function checked, blood pressure checked, check for diabetes, check for anemia. If these symptoms are ongoing, severe, or just chronic, it is important to have a medical checkup. But for actually supporting us in dealing with this constant state of being, or supporting us through acute stresses, and that can include bereavement or looking after a member of the family who's in acute difficulty, work deadlines. So for either managing acute situations or ongoing fatigue, debility, and chronic stress symptoms, and indeed insomnia. Insomnia to me means poor sleeping pattern for longer than 3 to 4 weeks. Then using the valerian blend for 3 to 4 weeks would be a very helpful intervention. So why is it so good? I would look at the range of actions that we are achieving with this blend of herbs. So we have nervines, carminatives, antispasmodics, anti-allergies, more antispasmodics, bitter nervines because they get the gallbladder going, more antispasmodics, promoting sweating, calming down the nervous system, relaxing muscle tension, enhancing heart function in terms of stamina, just giving the heart a little bit of sustenance. Sustenance is a lovely word, because the heart muscle works 24 hours a day, 7 days a week, 365 days a week. So I think it's very nice to give the heart some support when it's working this hard. And of course, it works extra hard with chronic stress. So that's mainly the hawthorn. We have a mild analgesic effect because often we get muscle pain and discomfort and we get headaches. We get the lovely calming of lavender and soothing of the digestion. The valerian is the most specific and the most researched anti-anxiety and supporter for sleep. But how nice that it's also anti-spasmodic and relaxes the muscles. Lime flower is an anxiolytic nervine, but it's also restorative to the mucous membrane. And of course, we often get coughs and colds, and I would say that background stress is one of the pre-existing features which leave us prone to allergies such as hay fever. We have nice alterative effects promoting sweating, and more sedative nervine and antispasmodic, and releasing the small blood vessels. Because, of course, another feature of chronic stress is that we tighten the tissues, and that includes the small blood vessels. And, of course, stress is a common feature of high blood pressure, which would be characterized by having increased tension in these small blood vessels. Even saying the list of herbs is calming for me. The chamomile, cramp bark, vervain, elderflower, hawthorn, Jamaican dogwood, lavender, valerian, lime flower, and passion flower. That, to me, is poetry. This is probably the blend that is most popular through our dispensary and is useful for day-to-day stresses, chronic stresses, and chronic sleep problems. How long to use it for? I would make a comment on this as with all of the herbs. For chronic conditions, you're probably talking about a minimum of 3 months. For sleep disturbance, don't even start to use it unless you're prepared to use it for 6 weeks continuously. For insomnia, people have the impression that they can take a little bit of medicinal herbs an hour before they go to sleep and that's it, bingo. Wouldn't that be wonderful? But that's not how it works. The stress blend, relax blend, works by keeping the stress and the tension in the tissues more relaxed throughout the day so that you are more ready to go to sleep when your head hits the pillow. And this should be used in conjunction with all of the usual advice for insomnia: getting to bed regularly, making sure you sleep in a dark room, avoid caffeine, all of the other lifestyle factors that you may be aware of. The Valerian Relax Blend is really, I would say, a gift to help us through these difficult times. Times are always difficult. For sometimes it's survival issues, sometimes it's hunger, thirst, hard labour, exploitative situations. But in this time, in this century, it seems to be manifesting in just an overactivity in the nervous system, mental choices that we battle with within ourselves, doing non-physical work, which is typical for most of us today. Even the farmers don't walk anymore. They go on their tractors and their quad bikes, as I've learned. So not being out in the physical world, not having contact with natural cycles, these all seem to be having their effects on our nervous system and adrenal gland. So I hope if you or those around you or those who seek advice are in this situation, that they may benefit from using all or any of the herbs in this blend. Combine them to suit yourself, but these are all herbs that would be very useful. This is my dog Tigger, who unfortunately after 14 years as our wonderful companion passed away very peacefully about 6 months ago from when I'm recording this. I put this slide in. This beautiful dog had such a wonderful effect on my stress levels. And in fact, I imagined that state of having no tension in the elastic band if I was to lift up his paw and just drop it, and it would flop beautifully, elegantly back into a nice integrated shape with his body. And whenever I was doing mindfulness, I would try and mimic that effect. This isn't just my experience. Animals have a great effect of reducing our stress. And one of the things I tell people who are stressed to do is to pet an animal, unless it's a goldfish, because they don't like it. Other things that make a difference are gratitude diaries. 3 gratitudes every day written down in a diary, a journal, a bus ticket. It can be thrown away, it can be kept, but write down 3 gratitudes, 3 things that you're grateful for every day. Keeping a journal is generally proven to be effective. Various therapies such as massage, reflexology, and acupuncture can be very helpful for stress. So various other therapies, and sometimes counselling is indicated if it's very severe and if people don't have the support that they need through particularly stressful times. Energy medicine, it's harder to find research on that, but I certainly have had patients who have found that very helpful as well. So it's not just the herbs, it's a whole body, a whole mind, a whole life treatment when you're thinking about dealing with chronic stress in particular. So thank you to Tigger, and just to have a little memory of him and an image for you to associate with all of these other modalities for reducing stress. This is a picture of the cramp bark, also known as the Guelder rose, Guelder rose. And I'm putting this in because it's one of those overlooked herbs. It's very common in people's gardens. Lots of viburnum species are in people's gardens, so I don't recommend that you pick this or use it. But just as background interest, you can see the petals are on the outside of these florets, and the flowers eventually work their way inwards until you have a central core of open flowers. It's very pretty, which makes it a very common garden ornamental plant. And the part of it that's used is the bark. And I've also heard of people using the twigs that are collected, the little tips of the twigs in the autumn when the plant is about to go asleep. I don't harvest this myself, and I don't recommend that you do, but it's just interesting to see a picture, and you can look up other pictures of it yourself. It's a lovely ornamental shrub. One of those ones that people don't think that they have a herb garden when actually they do. Between that and their dandelions and their shepherd's purse and their birch tree, they've got much more of a herb garden than maybe they thought they had. So a lovely shrub to have for your garden.